More than half of teens say the pandemic has affected their mental health, and with so many people struggling, it's important for parents and caregivers to create opportunities for honest and open discussions. Joining us to help learn more and get tips on how to start those difficult conversations is Dr. Kim Palmieri, a pediatrician with ProHealth Physicians located in Groton, Connecticut. Dr. Palmieri, thanks so much for your time.
Thank you so much for having me.
So first, how serious a problem is this? And like, what role did the pandemic play in worsening the situation?
So it's made a huge impact in children's lives. The COVID pandemic that everyone's been dealing with, about 58% of kids indicate that they have really struggled during the pandemic emotionally. And at any one time, there's about 1 in 5 kids that are struggling with a mental health diagnosis.
Okay, so it's been described as a crisis. I mean, are you seeing it personally? Are these things that in your own practice that you've been saying, wow, I haven't seen this before?
So in all honesty, we've always seen it, but it's gotten significantly worse. Every single day, we're dealing with multiple children who are having anxiety, depression, problems sleeping, problems focusing. And it really is affecting their ability to be productive in school. It's affecting their relationships and their overall well-being.
So what do you look for in patients that might be an indicator that someone is struggling? And is this something, these things that parents or caregivers can also use to look for someone who's struggling?
So it depends on the age of the child. Some younger kids will be very fussy. They'll have poor sleep. Older kids may even say, I'm feeling sad or I'm worried. In teens, a lot of the time they won't say anything. And so you might notice that they're a little more withdrawn or are not coming out of their room as much. Sometimes they actually have, some behaviors that are concerning, whether they're not eating enough or eating too much. Sometimes they may be up all hours of the night, not just because they're a teen, but because they are having trouble sleeping. So there are a lot of different red flags that any change in a child's behavior should be noticed and brought to the attention of your doctor.
Well, I mean, that's the trick, right? Especially with teens. Sometimes they're up all night, especially in these days, they're on either social media, they're gaming, and you start asking questions like, hey, is everything okay? Or are you okay? And those types of things. And, a typical response will be, like, I'm fine. I mean, how do you start the conversations? How do you get them to open up and kind of communicate to someone that wants to help them?
So there's a lot of different approaches. Sometimes just starting the conversation every day. And at first it's going to be awkward and it's going to be difficult to get any words out of them. Sometimes I will just encourage them, a parent to say, how was your day? Or what was the best part about your day? Or is there anything about your day you wish was different? How are things going with friends? And they might not be willing to talk initially, but over time, when it becomes more of a routine, it'll feel more normal and more, less awkward. And so they might be more willing to talk. There's also a great resource on optumconversation.com. Basically, our parent company, Optum, has created flashcards that are easily available that can help to trigger the conversation, whether they're asking, when was the last time you felt really happy? Or what are you grateful for today? Those can be signs that, if kids are willing to talk a little bit, if they're struggling, you might notice some answers that are a little concerning.
And is this an everyday thing? I mean, how frequently should families be, trying to reach out and talk to kids about these issues?
So at ProHealth Physicians, I encourage my parents to talk to their kids every day. Even if it's, give me a number from 1 to 10. 10 is I feel great, and 1 is I am really sad or I'm having a really rough day. Give me a number. What's your number today? And if you do that every single day, eventually you might start to notice a trend, or at least be able to get a little bit more information out of them. If all of a sudden they're a 2 when they've been an 8, well, how come you're a 2 today? And that can sometimes help make the conversation a little easier to start.
I think, one of the challenges is that there's still a stigma about mental health, about just talking about feelings and issues. I mean, is there what's the lesson as far as not waiting, is getting involved and talking to kids?
So, kids that are brought to medical attention with regards to their mental health are much less likely to develop issues down the road with regards to legal, financial, health, social functioning. The sooner that they come into their doctor's office, if there are any, possible concerns, the less likely they are to have issues down the road. So, if there are any questions of whether this is something to be concerned about or not, there's no harm in bringing your child to your doctor and having the doctor try and tease some of that out.
Yeah, I mean, if the problem persists, if you're noticing that you're seeing that the feelings are intensifying, what do you recommend?
So there are multiple different options. You can always lean on your pediatrician for resources, local therapists. Psychologytoday.com is a great resource. You can actually search for therapists on your own. You can also, if you're really concerned, always lean on the emergency department or 211 as a resource to help a child in crisis.
Okay, is there anything else that we missed? Is there anything else you'd like to add?
So I just want to encourage families to talk to their kids every day, make sure that if they have any concerns, bringing them to their doctor. We at Pro Health Physicians are always available, whether it's by video visit or in person, to address mental health needs, which can affect kids' physical well-being as well. So the sooner you get brought into attention, the better chance of this being a short-lived issue and not leading into adulthood.
Okay, thank you. Joining us today, talking about mental health in youth is Dr. Kim Palmieri, a pediatrician with Pro Health Physicians located in Groton, Connecticut. Doctor, thank you.
Thank you very much.